Welcome, everyone. My name is Lindsay Goldman, CEO of Grantmakers in Aging. Grantmakers in Aging is a national membership organization that serves as a network and resource for funders and a champion for aging-related issues and investments. With over 100 members, GIA works to mobilize the social, intellectual, and financial capital required to improve the experience of aging now and in the future. It's my pleasure to welcome you to today's session titled Mapping for Age-Inclusive Policy, Planning, and Funding. I'd like to thank the John A. Hartford Foundation for their support of today's webinar. Interactive maps enable users to visualize and understand the complex spatial relationships between older people and the environments they occupy. When used by policymakers, planners, and funders, these maps can help improve access to local programs, resources, and amenities, and improve quality of life. Today, I'm excited to share with you mapping efforts happening in New York and New Jersey, and how these tools are being used to catalyze transformational change. Joining us today, we have Elana Kieffer, Acting Director of the Center for Healthy Aging at the New York Academy of Medicine, Emily Greenfield, Professor at the School of Social Work, Rutgers, the State University of New Jersey, and Julio Urbina, Vice President and Director of the Healthy Aging Program at the Fan Fox and Leslie R. Samuels Foundation and former GIA board member. Thank you all for being here. We will be recording today's session, and in the next few days, you will receive an email with the webinar recording along with the presentation slides. We'll have a Q&A portion following our panel presentations, so you can submit your questions at any time using the questions box in your control panel. Elana, now I'll turn things over to you.
Okay, hello everyone. I hope you can see me. Let me know if there's any issues. You can go to the next slide, please. So I'm Elana Kieffer. As Lindsay said, I'm the acting director at the New York Academy of Medicine's Center for Healthy Aging. For anyone that does not know, the New York Academy of Medicine, our mission is to drive progress towards improved health through attaining health equity. And one second, okay, there, now I can see myself too. And we do this through three main mechanisms. We have our Fellows Program, which is a network of over 2,000 professionals in the medical, social work, and public health professions. We have a world-class medical history library, and then we have a wide range of research, evaluation, and policy programs on any number of health equity issues. Next slide. We were actually founded all the way back in 1847, which, as you can see, is 175 years ago. So we are celebrating all year long our 175th anniversary. So we hope that you will attend some of our virtual, and if you are in New York City, our in-person events throughout the whole year. Next slide. So at the Center for Healthy Aging, we work to improve the health and well-being of current and future aging populations. And Lindsay did not say this, but she actually founded the center when she was at the New York Academy of Medicine. And I am now trying to follow in her footsteps. And you can see here what our goals are at the Center for Healthy Aging. And you can see below that we do this through four main ways. And today I'm going to be speaking about the second one, which is promoting data-driven planning and policy. Next slide. So if we all can remember a time before COVID, I know that's hard to think about, but it did exist. And we also had other emergencies going on before COVID. And one of them, of course, was Hurricane Sandy, which was back in October of 2012, so almost a decade ago. And Hurricane Sandy disproportionately affected older adults in New York. And actually, Lindsay, when she came to NIAM originally, she was tasked with leading this report that you see before you, which is called Resilient Communities. And it was really an initiative to really assess the health and well-being of older people in New York, both during and after Superstorm Sandy. And Image NYC, which I'll be talking about today, was created in response to the recommendations that emerged from this report. Next slide. So NIAM was interested in better understanding where older adults lived how they were living, and which resources they were living near or not living near. And so NIAM partnered with Steve Romalewski and his team at CUNY, the City University of New York, their mapping service at the Center for Urban Research and their graduate center to create Image NYC, which you can see here, is an open source map of New York City's current and projected population of people aged 65 and older, with overlays of available services, resources, and amenities. This data visualization tool, which I'll show you in a moment, enables users to understand and analyze spatial and sociodemographic patterns and trends using what are called neighborhood tabulation areas, or NTAs, which are statistical areas that are created by the New York City Department of Planning by aggregating census tracts. And typically an NTA in New York City has a minimum of 15,000 residents and an average of about 45,000. And you can see here on probably the right-hand side of your screen, the 3 different goals that we had originally for the map, which were to facilitate more informed planning, to contribute to better delivery of culturally and linguistically competent services, and to catalyze connections leading to increased social cohesion, which of course is now more important than ever. Next slide. Oh, no, not yet. Very important. Just go back one slide, please. Because this is a GIA webinar, I would be remiss if I did not point out our funders for this image map. We were very fortunate to have continued funding from the Samuels Foundation, and you'll hear shortly from Julio Urbina at the Samuels Foundation, as well as FJC, Foundation of Philanthropic Funds, and they have continued to make it possible to not only develop, but maintain this map. Now you can go to the next slide. Thank you. So this is a busy slide right here. I just want to give you a quick snapshot of the map, and I will break it down for you, so do not worry. But this is one example of what the map looks like and how it can be useful. So right now, we see a lot of different things. So let's just start with the green in the background. So we talked about sociodemographics, and so all of the different kind of shapes on the map are those NTAs, those neighborhood tabulation areas. And the different shadings of green show you, and you can see in the legend, the income for people age 65 and older who are living at 200% or lower of the federal poverty level. And so the darker the color of green, the higher percentage of older adults living within that income bracket. All of those different kind of colorful icons on the map are showing those services and resources that we talked about. And I just picked a few here just to give you a sense. So those different icons represent hospitals, senior centers, Section 202 buildings, caregiver support services, and a few other things. So already, without knowing anything more, you can already start to see where there are services, where there are not services, where they're clustered, where they're not, without having any other information. Next slide. So one of the great things about this, one of the many wonderful things about this map is that there's so much information available. And once you start playing with the map, you'll be able to kind of tailor it to whatever your needs are. And I just want to say at the top, even though this is all about New York City, Emily will talk soon about adapting this to New Jersey, but we're really hoping, even though this is very New York City centric, that this is really can be applicable no matter where one works and where one lives. So there are many different ways of searching by location on this map. The most common one is by neighborhood, but you can also just type in your address, the address of your office. You can look up different legislative areas like your congressional district, zip code, many different types of geographic areas. So that's on the left-hand side. And then on the right-hand side are those different services and resources and amenities that I talked about. So each one of those gray bars is a drop-down menu. And you can see, obviously, we created this map. This map was launched back in 2018, but of course we update it all the time, including at the very top with COVID vaccine sites. And there are tons of different services and resources under each one of those maps, under each one of those menus. Aging services is the ones where you'll find the senior centers and congregate meal sites, et cetera. For another example, recreational assets, cultural institutions, there'll be libraries, recreational centers. Under housing facilities are affordable housing sites. So you get the idea. Next slide. So then we go to sociodemographics. So the image that I showed you at the beginning was, you can see on the right-hand side, population and poverty, and looking at the bottom one, income for people under 200% of the FPL. So on the left-hand side, there are all these different sociodemographic characteristics. Also a drop-down menu with many different types of sociodemographic traits. I'm not going to go into them, but just you can play with them in your own time. Just click once, Alice. And I just want to point out that the majority of the data, although not all of it, comes from the American Community Survey, which is part of the Census Bureau. And a lot of the information, for anyone that loves looking at data, can actually be downloaded into a very large Excel spreadsheet that you can download right from the map to look at a lot of this data side by side, broken down by neighborhood. Next slide. Okay, so let's do a little example. I'm going to put on my funder hat and pretend to be a funder. So let's say that I want to invest in a program that addresses social isolation among older adults in New York. And I want to know where there are high rates of older adults who are living alone, and see where there are senior centers, or now they're actually called older adult centers, and other programs that may already be helping to reduce isolation, so I don't reinvent the wheel. But I also want to know what transportation is like, as well as mobility issues of older adults throughout New York City, because I'm thinking about funding a program that provides virtual and telephonic programming. So you can see here on the left-hand side, the sociodemographic characteristic here is the population of older adults who are living alone. Now that isn't not necessarily mean that someone is isolated, but it could be an indicator that we would use to identify that. Next slide, or next, click again. So now I'm thinking, okay, so now I know where the population is, where I might want to focus more to help reduce social isolation, but what's already there? So I know, again, it looks very messy, but I will just quickly walk you through it. These icons display older adult centers, social adult day centers, and what are called social connection programs, which are essentially friendly visiting programs that bring volunteers into older people's homes for in-home visits. So again, I want to see where there's where there are gaps, and that may be where I focus my programs. Next slide. Okay, so now this is basically the same as the second map. However, now I'm thinking about mobility issues. Where might it be that there are older adults who have ambulatory issues, or have easier or hard time getting to places? And so the little blue dots are bus stop shelters, which of course make it easier for people who have ambulatory issues to get around and to rest while they're waiting for the bus. And you can't see it that easily, but there are these little blue boxes here with an escalator, and those represent ADA accessible subway stations. So all things related to mobility. Next, click. So the other cool thing about the map that we actually created, thanks to people like Julio and Lauren at the Samuels Foundation and others who were helping us with the beta testing, said, okay, that's great that we have, we can look at one sociodemographic characteristic, but of course, these things are not in isolation. We want to understand multiple characteristics together. And so we came up with this tool, which it's probably not the formal name, but I call it the slider tool. And it allows us to compare two different sociodemographic characteristics at the same time. So of course, if we're thinking about the living alone population and ambulatory difficulty, it starts to paint a more defined picture of what we're looking at. So you'll see in this map that anywhere where there's that kind of gray cross hatching in the neighborhoods, you'll see at the bottom that indicates these are areas where at least 30% of the 65 plus population has a reported issue with walking or with ambulating. So now I'm thinking more, now I have two different traits to go on. Next slide. So given everything I just told you, we have all this information on this map, and now click once more. I zoomed in and I identified from that the neighborhood of East New York, which is in Brooklyn. And I can see here that there is, you can see already 43% of older adults live alone, which is relatively high. At least 30% have trouble walking. And you can see there are actually just not many icons there at all. And so this might be a place where if I want to build some kind of physical space to help reduce social isolation or do something, there are not a lot of services there right now. And this might be where I locate whatever service I am hoping to fund. Next slide. So that is just a very quick walkthrough of one example of many, many, many in how this map can be used, particularly from a funding perspective. We hope that you'll check out our map. You can see the website right there. This is the basics of how the map looks when you log on. And there are how-to videos and there are resources and test cases, and we hope you'll check it out. And now I will turn it over to Julio.
Great. Good afternoon, everybody. I hope that everybody can see and hear me. Thank you for including me in today's presentation. So, we actually started, we being myself and Lauren Weisenfeld, who's the Deputy Director of Healthy Aging at the Samuels Foundation. She and I came on board about 20 years ago when the foundation chose to have a different, or chose to change the strategy from applied research to direct service. And Lauren and I did not have a lot of experience with older adults. And so we felt that we understood that there were older adults in New York City, obviously, but we weren't quite sure where they were. So we learned about an organization called NYPIRG, which is the New York Public Interest Research Group. And they had a mapping service, and we asked them to create a map to show us kind of where older adults were in New York City. And they did just that. We had this paper map that hung up in my office. And as we started funding projects, we would put pins, on the map, and it looked really cool. But it was very limited, and it soon became kind of obsolete. And then, kind of long story short, then we learned about Image Map. In fact, we were approached by the New York Academy of Medicine about the image map and whether or not this is something that might help us, with our grant making. And we immediately saw that, unlike the paper map, that this was going to be a much more robust tool. That we immediately saw the benefit of having a tool like this available. And in fact, it has helped us inform our grantees and also our potential grantees, so much so that we now require our applicants to create a map. And this slide, what we're showing here, is a part of our online application. We use Foundant, to have folks apply for a grant. And you'll see here that we asked them to use Image NYC mapping site to create and upload a map of the geographic area affected by the proposed program. And not just what geographic area or what your catchment area might be, but also asking them to identify what resources are available. And like Elana said, so that we're not replicating or we're not duplicating, some of the efforts and resources that are already over there. And so I think that, it helps our grantees, understand where the needs are of the population that they're hoping to serve. But it also allows us to do some of our due diligence, or helps us with our due diligence, to make sure that we're funding programs that are going to have a positive impact in a particular area, rather than duplicating something that might already exist. So if you can move up to the next slide, Alice. So the next slide, so we started finding that, there were some very basic maps that people were creating. This one here is showing, an area of Manhattan, and it would give you the solid color gives you the population, or the percentage of the population that is, considered older adults. And then, as Elana explained, that cross-hatching also has at least 50% of the household headed by someone, in this case, 65 or older, where the household income was less than $25,000. So this was giving us some information, but we found that some folks were using the map well and identifying what resources were available and what resources weren't available in the areas that they're asking us to support. But we also saw that some grantees or potential grantees, excuse me, were using just a very basic map so that they could check, the box on the application. And so we found ourselves, having to work with them to create more robust maps. Next slide, please. So you can see, like Elana had shown also, we were able to show and to overlay some of the other resources that were available, in different communities. And that's really what we're asking our grantees to do, is to make sure that whatever program they're proposing, that there is a need for it, and then to have them show us that in fact, there is a need for us. I'm sorry, for the work that they're asking us to support. But again, we found this to be so useful, but now we're starting to think, and I think Lauren and I decided that instead of asking for this map at the application stage, we are now going to move this requirement upstream at the letter of intent stage, so that right from the beginning, the potential grantee or the applicant understands kind of what resources already exist in the community and that there is in fact a need for that. And again, it also helps us with our due diligence to ensure that whatever they're asking us to support makes sense in a particular community, so that we're using our grant making dollars as best as we can and to have the greatest impact in the greatest area of need. And so just to be transparent, our initial investment with Image Map NYC was to get the program up and running. That was a $40,000 grant. But again, we saw how valuable it was to our work that we then gave a second grant of $100,000 to make the map even more robust and to make it a bit user-friendly. So the map, this particular map that we're showing here is in New York City, but there are applications to other communities. So with that information, I'm going to ask Emily to pick up the presentation and to tell us about your work in New Jersey.
Thank you so much, Julio, and hello to all. I see a lot of friends and colleagues on the webinar participant list, which is wonderful. And for new friends here, again, my name is Emily Greenfield, and I am a professor of social work at Rutgers, the State University of New Jersey. It is such a privilege and pleasure to lend my voice as part of this webinar, my voice that is really just part of a growing chorus of voices, singing tunes of innovation, of possibility and progress toward a better future for aging and aging equity across our diverse communities, our different social positions, and our vast geographic locations. So it's with this spirit in mind that I want to begin by situating the concept of age-friendly mapping under the concept of ingenuity. So if you go to the next slide, please. So ingenuity is one of several key frames for communicating about aging, as championed by the Frameworks Institute and the broader Reframing Aging movement. The quote on this slide is from the Reframing Aging Toolkit, stating, "As more Americans live longer and healthier lives, we need to tap into our national ingenuity so we can adjust our systems and policies to make the most of this new reality." Age-friendly mapping tools like Image NYC and the pilot New Jersey Age-Friendly County Mapping Project that I will describe are precisely the concrete tools that we need in the field of aging to go from aspirational visions for a better aging world to sustainable, widespread, meaningful, and equitable social change. Next slide. I myself first started considering how age-friendly maps can lead to better systems and policies when attending a presentation about Image NYC at the 2018 conference of the International Federation for Aging. As Lindsay Goldman, who was then at NIAM, displayed the Image NYC map and narrated its features, I quickly came to understand the power of age-friendly mapping. At its core, the map is a visual, something that makes things and patterns in the abstract more seen in the human mind. Through the mapping tool, you can literally view key assets for aging right alongside the gaps, all positioned relative to each other at a glance. The map further draws attention to issues of aging equity. We all know that older adults are not a monolithic population group, and that age, as one aspect of a person's social identity and position, is always at the intersection of many others, including gender, race, ethnicity, disability, and so much more. The fact that the map allows for finding geospatial concentration of adults ages 65 and older with other distinguishing characteristics, such as primary language spoken or their living arrangements, is essential for magnifying opportunities for more progress toward aging equity. Another important characteristic of a map is that it offers a customizable experience for users. Users can select a wealth of information to display: the location of libraries, older adult activity centers, parks, transportation lines, housing, vaccination sites, meals, adult care facilities, farmers markets, and the list goes on. The map literally puts it all in one place and then allows users to follow their own interest on what they want to see. And finally, it's the digital constitution of the map that allows for it to be fundamentally dynamic, allowing for it to be easily updated as time marches on and refreshed data become available over the years. Next slide. So recognizing all of this, I was thrilled when an opportunity from Rutgers, my home institution, came about that would provide seed funding for our efforts to adapt the ImageNYC tool for the landscape of New Jersey. Rutgers had launched a new interdisciplinary working group called Community Design for Health and Wellness, and as part of this, the chairs of the working group were provided funds from the university to administer small internal grants for innovative partnered projects that address upstream conditions for New Jersey residents' health and wellness. Drawing on prior networks and collaboration on age-friendly efforts in my state, we assembled a truly multi-sectoral team encompassing multiple units within the university and 2 county government systems: Somerset County, which is located in the north central region of the state, and Bergen County, which is located in the northeast. Our team also included NIAM and the ImageNYC team in a consultative role. Next slide, please. In short, our aim for this project was to take the age-friendly mapping tool developed for the dense urban geography of New York City and adapt it as a mapping tool for the less dense, more suburban geography of Bergen and Somerset counties in New Jersey. So fast forward 2+ years and a pandemic later, and the tool in New Jersey now exists. Next slide. This slide is a screenshot of the 2-county pilot tool, and there are parallel URLs for a page that takes you to just the Bergen County version, and then another page just for the Somerset County version. We very much welcome you to visit the site at the URL here and experience the tool, as I personally think that playing with it through the lens of your own interest is the best way to get accustomed to these kind of digital resources. I'm also happy to address any questions about the map in New Jersey during the Q&A portion of our time together. But for the purposes of my remaining speaking time, I want to make one last big picture point about the map. Next slide, please. Indeed, the pilot mapping tool that now exists for New Jersey geographies has translated the many wonderful features of the ImageNYC map into the context of New Jersey. Yes, it visualizes both assets and needs. Yes, it draws attention to issues of aging equity, and it is customizable and dynamic, just like the ImageNYC tool. But another powerful aspect of the age-friendly mapping project in New Jersey was the way in which the very process of creating this map has strengthened age-friendly collaborative capacity in our state. Next slide, please. Collaborative capacity is not a new concept, although it is new to the field of aging. The term comes from the thought leadership of Robert Chaskin and others who led and studied comprehensive community initiatives in the late 1990s and into the early 2000s. These place-based initiatives generally focused on economic development, youth, and younger families, although the conceptual insights on community development processes, I think, apply in many ways to age-friendly community work at its best. Broadly, collaborative capacity refers to the ability to mobilize human, social, and tangible capital across individuals, organizations, and networks, and to mobilize these different types of capital across these different levels within a community toward 2 aims. 1, to achieve a specific outcome related to a social issue, and 2, at the very same time, to continuously build the capacity of individuals, organizations, and networks to address a social issue in the longer term. I'm very happy to report that the very process of developing the age-friendly map in New Jersey Through a collaboration involving multiple actors across the public, private, and academic sectors, has enhanced the collaborative capacity for age-friendly progress in New Jersey. Next slide, please. So in my remaining minutes, I'm going to explain this point. Next slide. Developing an age-friendly mapping tool demands knowledge, skills, and other assets that are highly unlikely to be housed within a single sector, a single organization, or a single department. This slide summarizes key areas of needed skills and knowledge that are employed to do a project like this. Consider, for example, ways in which GIS capacity, that is the very technical skills involved in programming a digital mapping tool that's web-based and accessible and has a good user experience. These are essential skills. Our team was so fortunate to have a wonderful GIS mapping group at the Rutgers Office of Research Analytics who gave tirelessly of their time and talents to this project. But their team certainly couldn't have created this map alone. This map, as a map focused on aging, deeply benefits from gerontological expertise, that is from persons with training to consider not only the multiple facets of individual and population aging, but also the many relevant dimensions of the environments in which experiences of aging are embedded. But again, this conceptual understanding alone is not enough. The map requires people who have the capability of finding, integrating, and cleaning data sources that speak to the multidimensional prisms of aging populations and environments. And essential for the map to be meaningful and useful in a local context, having teammates with deep understanding of the counties, in our case, or broader geographies, is essential. Advising on key decision points, such as whether municipal level or census tract level data are going to be more useful for the end users of the map. And of course, given the team-based nature of developing the map, the project requires project management, persons who are skilled at delineating tasks, keeping track of timelines, coordinating efforts, and knowing when to pull conversations off of email and onto a Zoom call. Next slide. Fortunately, in New Jersey, we developed a team whose members offered this diverse skill set. As this slide demonstrates, the Age-Friendly County Mapping Pilot Tool is the product of a long-term collaboration across 4 big entities: Rutgers University, Somerset County, Bergen County, and the Image NYC team. But notably, within each of these entities are collaborating units in their own right, subunits within the larger organizations that found their way to working together in ways that they had not before. These relationships, both within organizations and across organizations, are as much as a win for the mapping project as anything else from the perspective of a collaborative capacity building. Next slide. To conclude, I'll now briefly summarize a few outcomes that have resulted from our release of the County Mapping Pilot Tool in New Jersey, recognizing that the site, the URL that I shared before, only went live as of January this year. One outcome that we are especially proud of is that both counties have formally committed to age-friendly community progress, in part by joining the AARP network of age-friendly states and communities. Now, did the mapping project itself cause this development? Well, that's a good question in its own right, but I think it's fair to say that the Age-Friendly Mapping project helped to move things along and to keep age-friendly plans in the mix of other priorities for county leaders, especially during a pandemic. Another outcome is both counties plan to integrate the Age-Friendly Pilot Tool within the development of their future planning tools. Both counties are actively considering the creation of 2.0 versions of the tool in the context of their own broader GIS goals, such as for economic development purposes and master planning. In the meantime, the counties are orienting department heads and age-friendly work groups to use our pilot version of the map in their own planning and discussions. The map is also getting used in the private sector. Private philanthropic funders in New Jersey have shared that, similar to the Samuels Foundation, they're encouraging, not yet requiring, but at least encouraging their grantees moving forward to use the mapping tool as they design and develop project plans. And finally, as one last note on the collaborative value of the map, our mapping team continues to work together. One example of the whole team's continued work together is that we are preparing a conference session for the major conference on aging in New Jersey this June. This session is part of our continued efforts to disseminate the map and encourage other geographies in New Jersey to consider developing it for their own corners of the state. Next slide. Finally, I'd be remiss without acknowledging the many, many individuals whose time and talents touched this pilot mapping project directly or indirectly over the past 2 years, including most recently PhD student Natalie Pope, who helped me to make this slide deck very beautiful. And I thank you all too for making the time for this webinar, and to GIA for selecting this important topic. Next slide. And with that, I'll say thanks again and hand the mic back to Elana. Thank you.
All right, thank you, Emily. So we just want to do a very quick kind of menu of funding opportunities as you're thinking about how you possibly could work on these in the areas that you work in and fund. Next, click. So of course, you can't have a map if you don't have data, and a map is only as good as its data. So as you've been picking up, we collected data from many different sources, some of which are publicly available, such as the Census Bureau data, but it still requires human capital to really kind of figure out which data to use, have to scrub it and clean it and figure out how to use it at what geographic level. And also different localities have different types of data that are available for free or for purchase. We're very fortunate in New York City to have a lot of publicly available data, but we know that's not always the case. And then the kind of asset or resource data also is really likely to come from multiple different sources and often needs to be kind of organized and conceptualized in ways that make the map usable. Next, please. And then, of course, you can't have a map without a mapping expert to create that. So you really need to be able to find someone that has those GIS, as Emily had mentioned, technical skills. Either that might be provided by a public source that already has the kind of GIS infrastructure built in, or as we went, the kind of more private or the academic sector route. It's also really helpful to have a GIS expert who not only has the technical skills, but also understands that this is really a collaborative process and is on board with that type of approach. Next. A lot of what we did to make the map what it is today is to really think about the user experience, evaluating the map every step of the way, to have focus groups, to have beta testing. That was another really key part, and to make sure that we targeted all different types of users, whether it's researchers, funders, social service providers, et cetera. So that's another key aspect of this map making process. Next, please. Also, we've been very fortunate to be able to work with the City University of New York and of course with Rutgers. It helps to have an academic partner or an academic lead, both in doing the kind of the research in order to kind of conceive of the map, figure out what we need. Also, of course, if they have a mapping center, the way that CUNY does. Also, if we were very fortunate to work with with undergraduate and graduate students to help with the data analysis and the scrubbing, training users in how to use the map, administrative tasks, et cetera. And one more, Alice. And also, we absolutely need a project manager to corral all of these different parts and to make sure that the project is moving forward. As you can probably see, this is a multifaceted, multi-sectoral, and multi-layered project. So of course, if anyone wants to fund it from beginning to end, that would be the best. And but you can just see that really there are so many key pieces to not only conceiving of the map and creating the map, but also to maintaining it and updating it as time goes on. And with that, I will turn it back over to Lindsay.
Now I'm going to invite all of our panelists back for our Q&A portion of the program. So please type your questions into the Q&A box at the bottom, and we already have a bunch of really interesting questions. So the first question is about the kind of data that you have included. How did you decide which data sets you wanted? What was the process like? And anyone can just jump in right here.
I will just start that I was actually not there when we created this map, but I do know that we kind of looked at what data was available in terms of the American Community Survey, really thinking about, of course, demographics related to the 65 plus population. NYC has a lot of data available. It's something called NYC open data, a lot related to different health factors, which of course are obviously very relevant. And then I know that Lindsay and her colleagues at NIAM did a lot of digging for other data as well. Maybe Emily, this is a more recent process for you, so you can go more into specifics.
Sure, yeah. So it's important to think about how there's kind of two buckets of data. There's the sociodemographic data about different characteristics of older adults. And for that, like the Image NYC map, we got that from the census data in large part. There was kind of a calling down process, like some of the I think the density of New York City allows for nuances in like tract level differences, let's say on like source of health insurance. So that was one of the, and in New Jersey, like we kind of looked at that, and at the tract level, we didn't see a lot of geospatial variation on that. So it didn't really make sense to include that on the map. So there was a process of kind of culling down the census variables into something that would be meaningful for geospatial units in our geography. The other bucket is the assets, of course, and those are, you know, equally compelling. It's kind of the combination of these two things that make the magic of the map, I think. And those data largely came from our county leads. It's their data. You know, they have their own records of where their licensed healthcare facilities are, where the libraries are located. And that was largely in their court, was to provide our GIS team Excel sheets that had updated information to the best of their knowledge. We had actually a student help with looking up some longitudes and latitudes to make that information complete, but the list came from them. It was a definitely collaborative process to figure out how to organize that information. Part of the challenge is we know that aging services in particular are highly decentralized. So what is relevant in New York City is kind of relevant for New Jersey. It's like a cousin, you know, like there's some resemblance, but there's really important differences. And then even between the two counties, like it's not even centralized in New Jersey, they kind of had different language or frames for organizing categories of things. So that took a lot of group process to kind of work through. And in the end, we kind of defaulted as a pilot project to not force uniformity and to let the counties lead with the language that made sense to them for their context. And with the idea that like this map was being developed as a pilot in collaboration with Rutgers, but then it would live on through the county systems in the longer term. And so it made sense to keep it in the context that the county was already using their kind of language. And then we're very lucky, my colleague Karen Alexander at a different unit in Rutgers is highly involved with transportation planning projects statewide around aging and disabilities. And so through her expertise and networks, we were also able to layer on transportation data, transit data that's an example of state level data. So that's where we were at with the New Jersey story in terms of data sources and that process of integration.
Yeah.
Now, are you still, oh, I'm sorry, go ahead, Julio.
No, I was just going to add that, you know, the Samuels Foundation's mission is very broad. It's to improve quality of life of older New Yorkers. You know, we felt that that NIAM and ImageMap were very responsive to, you know, how dynamic our mission is. You know, sometimes we'd be doing, you know, work with homeless older adults and wanted to get some more information, you know, on that population, or we wanted to understand, you know, who is enrolled in SNAP benefits, and wouldn't it be great to be able to see that on a map? And you know, and again, I think that's where you know, we were able to pull in additional data sources from the beginning, and that's really why we continue to support you know, this project, because you know, the more data that is available, the more robust that map can be, and acts as a better guide, you know, for our grant making and helping us achieve our mission.
Thank you. And for both of you, are you still in the process or open to adding additional data sets? Because we did get an inquiry from someone on the call who has some very interesting Medicare data that they've worked on. Would that be something that might be of interest in terms of some new overlays?
We are always looking for new data. And as long as it is relevant, we will happily put it on. And it can only enhance our map.
And I would say from our perspective, I mean, right now the map lives with the counties. Like we've made that transition, that sustainability plan of developing something that didn't exist as a team and then giving it, you know, to the counties for their further development. But there are broader age-friendly community movement developments in the state of New Jersey, and we're really early. So we're hoping that you know, this will live beyond the two counties that started it, and other counties might come on board, and there might be other funders and people interested in growing it from the pilot project. And so, yeah, new data sources would become highly relevant at that point.
Yeah, and I think that the use of the map becomes even more important as you add additional you know, data sources, and also update existing, you know, data sources.
Yeah.
This is why it's great that we've been able to work with FJC they are providing funding to ensure that the map is updated on a regular basis. Going back to my story of the original paper map, that was a snapshot of the population of older adults in New York City on that day, or maybe even that month. But again, having, partnering with other foundations that may not be able to create the map, but be able to support it and make sure that it's relevant and timely, is a great way of collaborating with other funders.
And I'll just add one more thing. That one thing that also comes up is data that is not available at the moment, which is also getting us thinking about that. So for instance, I just had a call this morning with, we've been hearing that people have asked us, where's data on LGBT older adults? We don't have that data. And we don't have that data because that data is not easily accessible or collected. And so that is one example of something that we're trying to think about, are there partner organizations we can work with to better collect that data so that we then can have that on our map.
Were you able to use the map to identify areas of increased need or risk of COVID throughout the pandemic? And were any new data sets added as a result of the pandemic experience?
Yes, definitely. So as soon as COVID hit, we knew we had to have image respond in some way. So one of the nice features about the map is you can create kind of instant links if you to look at different sociodemographics and services and then share them with whoever you want to share them with. And so we created a long list of maps based on indicators of who might be even more at risk, whether it's living alone, no internet access, food insecure, 85 and older, whatever those different demographics were. And then of course with the services as well. And we added them to our resources page so that service providers and others could just very quickly just click and see where they need to kind of where they needed to laser focus at the height of COVID. And then as I mentioned, we added vaccine sites. And then also obviously a huge concern and a continued concern is digital access during the pandemic. And we had actually already added some data on that because of some work we had done with census outreach, because the census could be online. So we were able to use that to help also identify where providers would be able to kind of look for people that did not have digital access, who again were more at risk.
Yeah, I mean, I think if our county map at the time of the pandemic were more developed and under state leadership, there would have been that ability to integrate that information. But because it's more of a pilot project and kind of just starting grassroots with the university in 2 counties, we really didn't have the capacity. But I think it kind of speaks to the broader issue of the map as like, there are other players using GIS mapping for other issues. And so kind of it's a good question to keep in mind, like how do you ensure that an age-friendly map or an aging-focused map, which is essential because you see all the complexities just on aging alone, like just to plot this onto something else, isn't necessarily what we're looking for, but trying to keep these efforts from becoming just kind of more fragmentation and staying holistic. And I think that's why, again, that collaborative capacity building, the kind of intentional development of relationships and developing a technical tool in the context of real people is essential to keep that coordination and communication going, so that as these possibilities rise, there's just priming to pivot those resources in a way that makes sense for the moment.
Yeah, and I know that Lauren and I both have image map bookmarked on Google because we're accessing it all the time. And I know that when we were looking at COVID and wanted to quickly identify underserved areas that, where we had grantees that we could make general operating support grants to support their work in COVID. It was very quick, and easy, to access. And again, we find this tool, very helpful with our grant making.
And so what are some of the strategies that you've used to raise awareness of the map and ensure that it's being used by the Aging Services Network, by policymakers, by funders? How are you getting the word out? And do you have a sense of how it's being used and who's using it from some of the analytics that you may be tracking?
Mm-hmm. So I'll start. So we absolutely do. We use Google Analytics to to analyze sheer numbers of use, not only of the map in general, but also specific pages within the map and within the kind of larger website context. Pre-COVID, it was easier to track the different types of organizations that were being used because almost everybody was working from an office. So we could see, oh, look, X number of users from New York Presbyterian Hospital were using the map, in March. It got a little bit harder to see that once many people started working from home, but still, it still gives us data. Obviously, a lot of people are back in the office now. In terms of how we've gotten the map out, I mean, we've done, we have a pretty active Twitter account. We're often using our social media channels to post not only about when the map was created, but when we add new data sets, when there are current events happening, we use the map to kind of complement what is going on related to different issues that are affecting older adults in New York City. We offer free trainings pretty regularly that are open and anyone can learn. And we also send out obviously targeted communication to different types of users. And then recently we've also been meeting with elected officials kind of on a more regular basis, because it is obviously can be very useful to them for many different reasons. And we've been specifically targeting people at the New York City Council who are on the Aging Committee so that they can better understand. The City Council is almost all new this year. And so a lot of people are just kind of, beginning to understand, particularly from an aging perspective, what the pressing issues are. And so we are meeting with them one-on-one to show them the map and explain how it can be useful to them.
Yeah, and we've, we require our applicants to create a map so that we get an understanding of what the need is in the community and that they confirm, what the need is in their community. And, while we were still having in-person meetings, at the office, oftentimes, somebody would mention something that we were meeting with and we'd say, oh, by the way, do you know about Image NYC map? Well, here, let's pull it up on the screen. And we would pull up the screen and show, folks exactly what the tool was, how it was accessible, and how helpful it could be. We have a New York, Grantmakers In Aging group, and we've had NIAM come to that group to show our other, partners, the utility, the map. So we're always, creating opportunities and taking opportunities, to introduce the map and have them use it in their work as well.
And I would say about our dissemination efforts, we just made the map go live as of January. So we're pretty new to this phase of the project, but I would say our primary priority and efforts right now are just getting the county leaders, all the different department heads aware of the map. Like we really, created in partnership for public sector involvement with the map as our first stakeholder community. And so that's really the focus for now, is to get them aware of the map and thinking about how they can use it. And then over time, introducing it to broader audiences, such as through webinars like this.
With either of the maps, can you learn anything about the quality of any of the services or resources that are mappable?
Yeah, so like one example actually is that we actually have 311, which is kind of like the information hotline in New York, calls that citizens make to this number 311 about different city conditions. So for instance, if there's like a sidewalk that has a break in it, or there's some kind of pedestrian or path obstruction. So we actually have that information on the map. So it's not specifically related to age. We don't necessarily know who the caller is, but it still is a way of really better understanding, especially if you can see kind of, in different neighborhoods, if there are higher percentage numbers of calls versus lower, that begins to get at different quality of services provided by the city.
Yeah, and I think I have an example of some of the work we've done with benefits enrollment or entitlements. We can see and kind of cross-reference the older adult population, or the percentage of the population in that particular area that has already applied for SNAP. And so we see, if you will, the quality of those outreach efforts by looking at those numbers. But then again, that guides our grantees and us in ensuring that they do a better job, or they focus and target some of their efforts in different areas that we might identify through the map.
I think it's another example where like if the data exists and it's a geospatial phenomenon, we could incorporate it into the map. So like one example that would come to mind, we didn't do this, but I think it could be something readily incorporated is like nursing home quality ratings. And you could create an Excel spreadsheet and basically feed that into the GIS to begin looking at whether concentrations of, let's say, nursing homes with a lot of complaints are spatially in neighborhoods, you know, that cluster together and address that. So I think it's possible, but wasn't something that we did for the initial round of the pilot.
Can you talk a little bit about how the maps are maintained when there's new census data? Is that an automatic update that happens, or is that a manual process? What does that look like? What are the costs?
It is not automatic. So we meet with the CUNY mapping service on a quite regular basis to talk about what new data is coming out. Of course, with the 2020 census and the American Community Survey, there's new data coming out, and we are constantly looking at the data, deciding which of those data to add to the map. And so it is really a constant process. And sometimes it costs money and sometimes it does not.
So I was going to say, what are the expenses associated with maintaining the map?
Good question. So certainly the work that the CUNY mapping service does, their time and their expertise and the technical aspects of uploading the data, combing through the data, all of that definitely costs money. And then also there are certain data sets that just cost money. So, you know, we have to decide if it's worth it. The Census Bureau data is free, but there are other data that is not. So we have to decide if it's worth it to use our limited funds to pay for that data. And sometimes we absolutely do.
And in our case, I know we realized it's a small internal seed grant from the university. That money was small to begin with, definitely not getting larger, at least from the university, was just to create a proof of concept to really show something that didn't exist, and then to like literally show that it can exist, and then allow for the counties to resource with their own public, dollars to decide how they wanted to maintain, how they will maintain the maps and ways in which they want to update it over time. So that was our, kind of sustainability plan. But again, like if there is possibility, if there were other interested parties who wanted to see that centralized across counties, like bring it back to the research university, if we had additional grant funding to do that, that's certainly something that we could do, similar to how NIAM's role has been playing out over the long term.
Well, we have reached the end of our hour, so I want to close by asking panelists for very quick final words of wisdom. Elana, I'll start with you.
To also just know, we didn't touch on this, but that this type of map can be used for many different age groups and different types of populations. And we've been lucky to actually speak with different organizations around the country that are thinking about this type of map for maternal mortality and for other issues. So we hope that as you're thinking about this for the older population, you expand it as well to others.
Thank you. Julio.
Well, Albert Einstein has a quote that says, you can't use an old map to explore a new world. And it's a new world out there that we're operating in.
I love that.
We find the map to be extremely useful. It helps us target our grant making and allows us to have the greatest impact on those older adults that we like to serve.
Emily.
I guess I'll just conclude by saying, innovate and aspire in the field of aging, but do it smarter together than harder.
Thank you so much. I really am so grateful to Elana Kieffer, Emily Greenfield, and Julio Urbina for being with us today. Again, thanks to the John A. Hartford Foundation for their support. As a reminder, we will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio, so watch for an email to be sent in a few days. Please join us for our next webinar on May 26th, Conveying Empathy from a Distance, using e-empathy in Goals of Care Conversations. Please follow us on Twitter, Facebook, and our LinkedIn page, and please complete the brief survey that you'll receive to help us improve our programming. And finally, thank you all for participating in today's webinar, and please be well.